Hello, good afternoon. Welcome on behalf of Cleveland Clinic Community Care COVID-19 Vaccine Virtual Event Series. My name is Dr. Teresa Dews, and I am the president of Cleveland Clinic Euclid Hospital. Thank you for joining us in this important conversation. Today, our panelists are Mayor Kirsten Holzheimer Gale, Mayor of the City of Euclid, Ohio, and Dr. David Hutt, who's Infection Control Committee Chair of Lake Health System, and he works in Lake Health as well as Hillcrest Hospital. Thank you for agreeing to participate in the discussion today. It is very much appreciated. This session will open up questions related to COVID-19. There are many questions, and getting the vaccination is a very personal decision, and it's been discussed widely in the community, in your family, at your dinner table, as well as in the news media. So we wanted to get together and give people the opportunity to ask additional questions, and perhaps we could help people make educated decisions related to their health. So I'd like to give Dr. Gale, Mayor Gale, the opportunity to discuss her perspective related to the vaccine and its impact in the Euclid community. Followed by that, I'd like to give Dr. David Hutt the opportunity to give some opening remarks as well. Mayor Gale.
Thank you, Dr. Dews, and thank you to everyone who joined us today. I am not a medical professional, so I'm hoping that my colleagues here will be the ones answering most of the questions. But as a mayor, it's really important for me. You know, I think the last year has been difficult on all of us. And what's made it easier for me personally and for the city of Euclid is to have partners like Cleveland Clinic Euclid Hospital and Dr. Dews, who has helped us, provide educational, answer our questions. We've shared PPE with each other. Euclid Hospital provided testing for our first responders. We had regular calls to touch base on what the hospital was doing, what they were seeing, what the city of Euclid was doing. I want to thank Euclid Hospital, Cleveland Clinic for providing testing in our community. And Euclid has done a great job. I want to thank our residents. I think they've really done a great job getting through this pandemic. We all have been watching the data, and the zip code data is probably the closest we've seen. And Euclid, across the board has really done very well. We've had lower numbers of positive tests through the pandemic. Our residents have been, really steadfast with wearing masks, maintaining distance, and our businesses have stepped up and, created new ways to provide services to our residents and our employees. City Hall has been closed to the public, but our city workers have been working through the pandemic, providing service in new ways. So we've, looked at ways to do things virtually and over the phone, and for that, I'm really grateful. So I got my second shot of vaccine yesterday. I was able to go down to the Wolstein Center and use the mass vaccination site. It was very easy. Really no side effects except a little bit of a sore arm. And so I do want to encourage, I think it's so important that we're having this conversation and that we can clear up, any misconceptions, any concerns, any questions. Really, the vaccine is going to help us get through the rest of this pandemic. And we all need to do our part. I trust the medical science. I trust the research that's been done. And I was, very excited to get my second dose yesterday, and excited to be able to, see the end hopefully near. And so thank you for inviting me to participate in this. I look forward to answering any questions anyone may have about Euclid and what we're doing, but really I'm thrilled that you're here and thrilled. I want to encourage everybody to get the vaccine and also continue to do their part wearing masks and following the guidance of the CDC and our health professionals so that we really do make sure we get through this.
Thank you, Mayor Gale. You are absolutely right. It's been a great partnership okay? And not only with you and the city of Euclid, but also the community of Euclid has been, excellent partners as we move forward through this pandemic. Dr. Hutt, do you have any opening comments?
Thank you for asking me to join the discussion here, and I really look forward to being able to do what I can to shed any light on questions or concerns that people may have. I don't have a lot to add to what the mayor had to say. We look back 13 months ago when this pandemic dropped into our lives, and it's astonishing what we've all been through, what we've learned, and the progress that we've made. And I think we all recognize that caring and thinking people may have questions and may have legitimate concerns about the vaccine. There's no question in my mind about its safety, about its effectiveness. I was I was the second person on our medical staff to get it when it was available, the Moderna vaccine that I got in December. My family has been vaccinated, my colleagues have been vaccinated. There's no question in my own mind that we all need to do two things to get through this pandemic. We need to get vaccinated, and we need to continue to follow all of the precautions and behavioral changes that we've been hearing about all along. So I'm happy to be here and hoping to be able to shed any light that I can. And if anybody, if we can anyway help someone to make a decision in favor of getting a vaccine, then we've accomplished what we set out to do this afternoon.
Thank you, Dr. Hutt. And that is excellent. I completely agree with you. If you have any questions, then please put them in the Q&A section in the window, and we will do our best to answer as many questions as we can. So again, put them in that question and answer window, and we will get right to them. So starting off with some questions that have been preloaded or people have asked in advance, what will the vaccine be a one-time vaccine, or will we have to get booster shots? What are some of the things that people are talking about at this point in time related to boosters and second vaccines?
I think that this is probably the answer I'm going to give may be an answer that I'm going to repeat. I have a feeling several times during the coming hour. The answer is we're not sure yet. Everybody has to recognize that unlike many other diseases that we've been diagnosing, treating, and vaccinating people for against for a very long time, this is all very new. So the simple fact that the vaccine is available and is as effective as it is truly astonishing. But we have not yet had enough time to answer several of these fundamental questions, and that's clearly one of them. We don't know how long the protection that you get from the vaccine is going to last. So those studies are in progress. I expect that we will continually be updated from the CDC and other health authorities about that. I will say that if my back were to the wall and I was asked to hazard a guess, that it might very well be that we will find ourselves lining up to get our COVID boosters. And whether that will be on an every year basis, like we're used to doing with the influenza vaccine, or whether it'll be more frequent or less frequent than that, only time will tell.
Okay. A follow-up question is that someone is mentioning that the Pfizer vaccine lasts for 6 months. So this is related to what you just answered, David. But after 6 months with the vaccine, will people have to get the Pfizer vaccine again? And then also the questions related to how long is the Moderna effective? So you did answer that, that we really don't know, that, there's more information we will be following, but there are some news reports that are giving timelines. Can you put that in context as to why there may have been reports for one vaccine lasting a certain period of time?
I can only say that I think that that may just have to do with the way in which the timing with which the vaccines have been rolled out, and the way in which the companies that are producing them are tracking them. But we don't really have much of a time frame beyond 6 months for any of these vaccines. Certainly not in wide use at this point. So I think it's just something that we're going to have to keep an eye on, and I'm sure that we will get updated information regarding all three of those vaccines as time rolls forward and those studies are done.
I do have another question. As far as what is the difference between the vaccines?
So in this country right now, there are three vaccines that have been given what the FDA calls emergency use authorization. The differences between them have mainly to do with the particular technique that the manufacturers have used to get that vaccine to cause the person who gets the vaccine to cause their immune system to produce proteins called antibodies that fight the virus. I don't want to get terribly technical on this call, but the differences among them really have to do with what type of technology the vaccine uses in order to evoke that immune response. The Moderna and the Pfizer vaccines are both what we call mRNA vaccines, and the Johnson & Johnson vaccine is what's called an adenovirus vaccine. I don't think that the differences among those are really particularly important or significant, but that's how they kind of divide up for the ones that are available to be used now in this country.
Thank you. So for my and everyone's understanding, the real key, the real job of the vaccines are to enhance our immune system to fight the specific virus. And so the difference is there's more the technology and not the real meat of what the viruses do. Am I distilling that down to?
Yeah, I think that's right. I think that in just to sort of take a step back and in very broad terms, what a vaccine does is takes a harmless form of a virus or a piece of a virus or a bacteria. There are some that are effective against bacteria, and essentially tricks your immune system into thinking that the actual microbe is present, so that it will fire up its artillery and fight against that germ, against that microbe. And so all of the technicalities about how you get it into the body and how you signal the immune system so that it thinks there's an infection that it has to fight, that's what vaccines are really all about. And all of the minutiae, mRNA, adenovirus, and so forth, are all just different versions of the way in which that technology gets your immune system to respond.
Thank you. Thank you. Mayor Gale, I have a question for you. Does the city of Euclid have plans to be a vaccination location? And what education are you providing the community through the city?
Thank you, Dr. Dews. We actually have had some conversations with our state representative. Kent Smith is working to bring a vaccination site to Euclid. So we're working through the details of that. It's with another hospital system, so I won't say that here, but we're happy to work with, and I think everybody's working together. I mean, that's one of the nice things that's really has come out of this pandemic is everybody coming together to provide information, to provide access to vaccines, to provide access to testing. And so we all want that for everybody. So we are working towards what's called a pop-up site, but we don't have a date yet. The best way that to get information about what we're doing in the city of Euclid is through our website, which is www.cityofeuclid.com. We do have COVID-related information. We have links to resources. And so we certainly would put information about a vaccination site on that website, and we have a robocall system that we would use as well. So we are hoping to be able to do that, especially for part of our population that has mobility issues and can't get down, have not been able to get it. So we are working on that. And again, information, we're happy to be a resource, and we appreciate the partnership of Cleveland Clinic Euclid Hospital for the resources that you've been able to provide us.
Thank you. Thank you. So there are additional resources that we're going to discuss at the end as we're pulling everything together, and we'll have some outreach there. There were other questions related to known impact of the vaccines, such as administration in women who are pregnant or planning to become pregnant. And then a corollary, but not necessarily together, are questions related to impact on fertility. Do we have any information that we could, communicate to people so that, again, they can make some decisions about their care?
Yes, Teresa, we do. People should understand that the way these vaccine trials were designed, they specifically did not include pregnant or breastfeeding women in the initial groups of people who were studied, and that was not done because of a concern that there would be safety issues there. It simply had to do with the desire to get the easiest way of getting these studies up and running in an efficient way. The fact is that a number of pregnant women have been given the vaccine. There has been no report of any adverse consequence for the pregnant mother, for the baby, or for breastfeeding women. There has been none. And that has been watched very closely, both by the manufacturers of these three vaccines and by the CDC, and has also been watched, folks should understand, very closely by the professional organization of obstetricians and gynecologists, what's called ACOG, the American College of Obstetrics and Gynecology. The folks are welcome to look at the CDC website, look at the ACOG website. There's universal endorsement of the safety of giving these vaccines to pregnant women. I think that it's important for pregnant women or women considering pregnancy to understand, as you're weighing that balance of, do I want to do this, would I rather wait, that the mere fact of being pregnant in and of itself does increase to some degree the risk of having a more complicated course if you were to become infected with the COVID-19 virus. It's not high up on the list of things that we know are associated with a more unfavorable outcome if the person gets sick. But I think there's very clear data that pregnancy alone does confer some increased risk for how sick one will get if they're unfortunate enough to get infected with COVID while they're pregnant. So I think that from everything that I have seen, I have read, colleagues I have spoken to, and all of the science that has come out, I think it's quite clear that on balance, this is safe for pregnant women and for breastfeeding women to take. I also know, along the same lines, the other question about concerns about fertility. For reasons that are not clear to me, this is one of those things that seems to be kind of floating around out there. There is no evidence at all that any of these three vaccines are associated with decrease in sperm count or with any other fertility issues at all. So I think that people should feel very comfortable that should not be any kind of an issue as they decide whether or not to get vaccine.
Okay. another question that's come across is the whether or not there's a differential response, immune response to the vaccine versus to getting COVID-19.
So if I think let's be sure I understand the question. I assume that what the questioner is asking is, if you get infected with COVID-19 and thereby develop some immunity to it, how does that compare with the protection that you get if you get your immunity from a vaccine instead of a natural infection?
Yes.
And so I think that it's clear that that most people who are infected with the virus develop a more, what's the right word, a more robust response, develop higher levels of antibody than do people who get the vaccine, understanding that there's a wide range in both camps. So in other words, if I get infected with COVID, being a generally healthy 67-year-old white male, the amount of antibody that my immune system produces might be very different from that produced by a 30-year-old who gets infected. And the same is true of my response to the vaccine compared with the response to the vaccine of someone with different physiology and a different medical background. But I think as a rule of thumb, we believe that most people who get natural infection will develop higher levels of antibody than people who get the vaccine. What we don't know, I'll kind of anticipate that maybe someone would have a follow-on question, is as far as we talked a few minutes ago about how long is the protection lasting? And we said that we think that, there's been reports about Pfizer, you mentioned, causing, being effective for at least 6 months, but that we don't really know what the parameters are there. I think that the same is true for naturally acquired infection. There's a real wide range, and time is going to tell whether or not the antibody protection that you get from natural infection is shorter or longer than that you get from vaccine.
Okay, thank you. Thank you. Dr. Gale and Dr. Hutt, Mayor Gale and Dr. Hutt, I'm so used to saying doctor, so
That's okay.
Keep coming out. So what about supporting diverse communities and hesitancy in diverse communities? And how can we support people who are coming from different circumstances or different religions, different philosophies, different cultures, or the same culture to ask questions and to make decisions related to the vaccine for themselves and their families?
I'll take a quick, a stab at that. And I think it's important for people for lots of us who have gotten the vaccine to talk about it and talk about our experience. And so when trying to, and educating people, making sure through forums like this, through information that we send out, we use the Euclid Observer, which is a community newspaper, to send information out. And I think people look to trusted people. So, the fact that you, Dr. Dews, are speaking out about it, I would hope that people who, the African-American population may see that and take, your word a little, maybe different than mine. And so the more we can get out and talk to each other, talk to people we know, bring together these community forums, I think that will help a great deal. I think that, the pop-up vaccination sites, getting it to the people, especially for the particularly vulnerable and people who can't get out. I think using forums like these, using community leaders to talk about it, to educate about it, and then making sure we're available to address any concerns that people have.
Thank you. Do you have anything to add, Dr. Hutt?
No, I just, I would just agree with the mayor that I think that the more information and the more public expression and encouragement and dissemination of information can be engaged in by members of various communities, the more likely it is that that message will resonate with a particular population. And I think that because we know that the disease itself has disproportionately impacted certain minority communities, it's that much more important that somehow we try to get the message into those communities to try to push up the vaccination rates in the communities that are particularly vulnerable.
Excellent. And I would agree with both of you. I mean, it's important for us to have ongoing conversations and not only talk, but also listen, because my experience is that everyone has their own reasons for any hesitancy or their questions. And it could be questions that they need to have answered, and it could be misunderstandings about, the vaccine or how the vaccines work. And so a lot of it is just really hearing people out and getting an understanding for, what their perspective is. So another question that's come up in a couple of questions is whether or not, if you've had COVID, how can you tell when your immunity has worn off, or if you've had the vaccine? How are we actually going to be able to tell? And let's see, this one question, they had very mild symptoms, and then they were tested twice and they have antibodies. So they're wondering, with regard to the actual disease, having COVID, and or the vaccine, how can we tell when we're going to need the vaccine again?
Yeah, it's a very, very good question, and one that is difficult to really honestly answer with precision. You can measure antibodies. That test is available, but a lot of weight is not really being put on antibody testing as a determinant of whether your immune capacity has drifted and whether a booster dose is required. And there are some a little bit technical reasons as to why that's the case. There are different types of antibody tests that are available out there. So they measure antibodies that are produced against different aspects, different molecules on the surface of the virus itself. And so the meaning of one antibody test may not be equivalent to the meaning of a second antibody test. And the other aspect of this is that the immune response is more complicated than just measuring the amount of antibody that's in the circulation. There are other aspects, there are other arms of the immune system called T cells, which carry a lot of the immune memory that we have, so that there are many situations where even if you can no longer measure antibody in the person's bloodstream, that doesn't mean that they have lost their immune memory of how to fight that particular organism. So we don't, at least at this point with the technology that we have, we don't really see relying on antibody testing to give us helpful information about when it's time to be boosted or whether or not naturally acquired protection from having been infected has drifted down to the point that it's no longer present. I think that for the foreseeable future, what we're going to have to rely on are the recommendations that come out of the studies and the follow-up studies by the manufacturers and through the FDA and through the CDC, letting us know about what the proper timing is for boosters. And it's going to be that rather than going for a blood test and measuring antibody levels.
Okay. So that begs a question for me. Do we have that information for any vaccine or any disease that we work with vaccines, as far as when you know the natural immunity wears off or wears down?
So we do have that information for a number of vaccines, and that's actually one of the ways that we've learned that a low antibody level doesn't necessarily mean complete vulnerability. The example that pops to mind, a lot of folks know about hepatitis B vaccination. Certainly all of us in the medical field are required to be immunized against hepatitis B. And now it's universally, at least in this country, universally recommended to be given to children. We learned a long time ago when it was required of people in the medical profession that if you did an antibody measurement sometime down the line and found that that person's antibody levels had fallen, that if that person got exposed to hepatitis B infection, that even though their antibody levels seemed to be very low or even unmeasurable, that as soon as their immune system saw that virus, their antibody levels shot up sky high. So that's what I was referring to before, talking about the other arms of the immune system, and the immune system being more sophisticated than just what's the measurable antibody level in the bloodstream. So there's a memory that we know with to your point, with other vaccines and other viral infections is certainly the case, and time is going to tell whether and to what extent that's valid for COVID-19, both the naturally acquired and the protection from the vaccine.
Thank you. So some additional questions. One related to who shouldn't get the vaccine. So, I mean, if you have pre-existing medical conditions, you know, is there anything that would keep someone or their doctor saying, you know, this isn't recommended for you, such as cancer or myasthenia gravis or multiple sclerosis, et cetera?
Right. For the most part, the answer to that for this vaccine is no. There really have not been any conditions that have been an absolute contraindication to getting this vaccine, except if you have had an anaphylactic reaction to this vaccine. And then we don't want you rolling the dice and trying a second time. But other than that, these other conditions which impair immune function or complicate a person's medical background, not only are they not a reason not to get the vaccine, but for many of those conditions, it's all the more reason to get the vaccine, because those folks are people who, should they become infected with the virus, are at particular risk from having complications, from having a more drawn out and complicated course, and unfortunately of succumbing to the virus. So people may be thinking by analogy to other viral infections for which we have vaccines where it's a live virus vaccine, so that instead of the way of, I referred previously to tricking the immune system into producing antibodies, well, we have other diseases where you actually give a person a non-harmful but live version of that virus. That is not what's going on with this vaccine. There is no live COVID virus in any of these vaccines. So we're not giving anything to a person with a weakened immune system that they might not be able to overcome, and putting them at risk of getting the disease itself. That absolutely, unequivocally cannot happen with this virus.
Thank you. Thank you. Another question relates to Because the vaccines have only been out for a very short period of time, people are concerned that we don't have the ability to know long-term side effects. Can you give some perspective around vaccines and when can we be sure about long-term side effects or not?
Yeah, I wish I could. That's my honest answer. And I totally understand the question, and I think it's a valid question. I think that what we should recognize is that we know about the safety in the short term of this vaccine, and it's astonishing. It's much safer, has been associated with much fewer side effects and much better antibody responses than many other viral vaccines that we accept and that we're used to getting all the time. I think that I think a part of this question is some skepticism about the speed with which this vaccine was produced. And I think that people sometimes understandably think, how did they do this so fast? And if they did this so fast, how can they be so sure that this is safe and that it works? And I think that people should understand that while it is true that this vaccine uh, was was brought to development and to market very quickly, much faster than any previous vaccine has been. It didn't begin out of nowhere in a vacuum last March. That a lot of the technology that went into the ability to produce these particular kinds of vaccines, the adenovirus vaccine, the mRNA vaccine, there was a lot of background work, a lot of very good science that had been done in the years leading up to 2020. And it was fortuitous that that technology, in a sense, was sitting there waiting for an application just like this. So people should understand that while the vaccines themselves were produced in what was certainly record time and seemed very fast, it was not based on any sort of flimsy fly-by-night kind of technology. This was the outcome of very careful, extensive kind of background work that had been done in the years leading up to last year. Regarding the long-term consequences, again, I can't give the reassuring answer that I would like to be able to give to that, but all I can say is that we know how threatening and devastating the infection is. We know how effective these vaccines are in preventing that infection. And to me, that's what I need to hear and what I need to focus on. And we know that no one can sit here and say that in the future we won't find some sort of consequence or side effect that we weren't aware of now. But we have no reason, based on the science that we know, to think that that's going to happen. And I think that we should all be focused on what we do know and what we can do. We do know this virus is still here. We do know that it's still harming people and killing people. We have patients in our intensive care units at Hillcrest, at Euclid, at Lake Hospital, all over this city still. And we have been given a tool to fight it. And I think that's what needs to inform what we do.
Thank you. Thank you very much. I'd like to remind everyone that if you do have additional questions, feel free to put them in the Q&A box. We are answering them personally as well as answering them live here. So again, place questions in the Q&A box. There have been some questions about variants, and there's a lot of concern, a lot of news reports. And so should we be concerned about the variants in the community? And what about the impact of the vaccines on these variants?
We should be concerned about the variants, and that should be one more reason to get whichever vaccine you can get as soon as possible. people should understand, let's just be sure we're all on the same page about the variants. So there have been naturally occurring genetic changes in the virus over the course of the last year plus that it's been circulating around the world that have changed its behavior and have changed its ability to cause infection. And there are three in particular that have circulated in the United States that are being watched. Folks should understand that we do not have as a readily available tool in our hospital and community laboratories in daily practice a way of identifying these variants. So when somebody says to me, well, have you seen a patient with a variant? Or the patient will ask me, was I infected with the variant? I don't know, because I don't have that technology available to me to be able to sort that out. So like everyone else, I get that information from the state health department and from the federal government that has the technology to look at it and track it. There are concerns about the ability of the three vaccines that we have available to us in the United States to be able to protect people against the variant strains. And some of these variants are more resistant and more of a problem than others. All three of these vaccines have some effectiveness in protecting people against the variant strains. So we know that it's not as though anyone who's gotten one of these three vaccines is completely at risk for a full-blown disease if they come in contact with a variant. What's more likely is that they will get good or partial protection from the vaccine that they have, so that even if they've been vaccinated with one of our currently available vaccines and then become exposed to a variant, it's likely that that vaccine will give them enough protection that it will modify the severity of their disease. I think in this discussion, the most important take-home point is, what can we do about these variants? What we can do is reduce the amount of virus in general that's circulating in our communities. And there are two things we can do to prevent that, whether it's variants or anything else. We can get vaccinated, and we can continue to be careful about our behavior with masking, with social distancing, and with environmental cleaning. And the more we do that, the greater the barrier we are all as a community gonna put up against the spread of the variants. So I have heard people say, I don't think I want to get this vaccine because you don't know if it's effective against a variant. And my response is, you must get this vaccine. You must choose to get this vaccine. I want you to choose to get this vaccine, because that's one of the tools that we have to try to decrease the threat that the variants will produce.
Excellent. And from that standpoint, I would just like to reiterate what you said, that part of what we need to do is decrease the total amount of virus that's out there. And the vaccination is one way of doing it, in addition to the mechanical or the social distancing, the mask wearing. That is really what's going to get us to the point where we're getting control over the situation. So I completely, agree with you as far as how important that is. And, other things that may be important that we don't really hear a lot about. Someone's asking, what can a person do to achieve or keep their immune system in top-notch functioning?
Well, I think that I'll say some things that sound like they may be very obvious, but I think that what we know is that good nutrition and physical exercise and getting adequate rest. These are all, these are all fundamental things that are critically important in terms of helping people keep their general health and their immune function intact. And so all of those things, alongside taking good care of any other medical issues that a person is challenged with, keeping blood sugar under good control, keeping blood pressure under good control. All of these things, we sometimes think about them as if they were separate compartments. They all work together to provide health and to boost immune function. So, I think that all of those things are critical, and people really should understand and take to heart that as much as all of those other things, continuing to wear masks, social distance is very critical. I wonder if I hope I'm not speaking out of turn here, but I think maybe I would ask the mayor, just in terms of the expectation in public places about the use of masks. That is still the expectation? Is that right?
Yes, Dr. Hutt, it is. I think it's really important that we all continue to wear masks. And certainly in our public buildings, you're required to wear a mask if you come in. I know many of the grocery stores, restaurants, all of that still require it. I know some other states are moving away from it. I think that's ill-advised. I think it's really important for all of us to do everything we can to make sure this disease goes away. And again, I'll repeat what you said. It's starting with the vaccine, but then we all need to wear a mask, maintain social distance, keep clean common surfaces. And I think we'll see the plexiglass, and we'll see spacing, and we'll see some of those things in businesses and in our daily life as a regular, as part of our everyday life. I don't think those things are going to go away. And certainly it helps protect us from COVID, but I think probably, the health experts can speak better. I think we've seen reduced flu incidents this year and other things. So that protects ourselves, it protects our family, but it protects the community. And so it really, that's really an important message, because I think many people think, oh, I got the vaccine, I'm free. I can go back to doing what I used to do. And that's not the case. We still do need to make sure that we protect the community and our family and, ourselves, co-workers. And the best way to do that is get the vaccine, wear a mask, and maintain those really important health precautions.
I do just want to follow on a point that you made, because it has been stunning how little influenza we have seen. We have admitted almost zero patients to the hospital with influenza this year. Some of that probably has to do with other factors that influence the drift of influenza from year to year. But I think there's very little doubt that mask wearing and hand washing has paid dividends there. And I think that it's interesting to me to see how second nature wearing masks has become, particularly to some of the very young people. My grade school grandchildren don't seem to think very much of it at all. It's just what they do. It's not a big deal. And it's the grown-ups who sometimes seem to have a little harder time with that.
Right.
Very much so. Well, we really are coming to the point where we can probably start winding down. The question and answer box has slowed down quite a bit. And there is one more question, so I'll take it. After the second shot, how many days will someone feel the effects? If you don't get side effects, should that be a concern? And I think they're questioning whether or not, if you don't get side effects to the second shot, did you get a good response to the vaccination?
Yeah, I think that the side effects. So the first question was about the timing of the side effect.
Yeah, how many days will someone feel side effects?
So the most common side effects that people feel, they tend to feel within the first couple of days, both for their initial shot and if they're getting Pfizer or Moderna with their second shot. There is a much lower incidence of a second kind of different group of side effects that are much less common that some people experience after a delay of about a week or so. But the most common ones are those that occur really within the first couple of days. In terms of the second question about should I be worried if I didn't have a reaction, it is actually a pretty sophisticated question. And I think that the answer is no, you shouldn't be. It does seem that there is some, let's say, inverse correlation with age. So younger people seem to get more severe reactions than older people. I heard this concern first from my mother-in-law, who's 94 and lives in an assisted living facility. And when she got her vaccine, she was concerned because she said to me, "I'm sure they gave me a placebo," which of course they didn't do. But it is true that older people sometimes have a less robust response. But there is no evidence that people who didn't get a bad reaction should feel as though somehow they didn't, that the shot didn't take. Whether you do or you don't, getting the vaccine is the right thing to do. And even if you didn't get a significant response, a significant side effects from it, you should feel confident that you've gotten the benefit and the protection of the virus, of the vaccine.
Thank you. Thank you. So with that, I think that we can wrap up and really appreciate your time. I really appreciate everyone else's time. I appreciate the participants who have joined us today. The goal of this webinar is really to give people the opportunity to hear from people who are boots on the ground, who are taking care of our communities, taking care of patients, and give time for people to understand and have further discussions related to the vaccines and to some of the questions that are out there. So again, I really appreciate everyone's cooperation and participation. There are several events that are coming up, and there are opportunities for people to get additional information and referring back to information. And these sites, and we have the COVID-19 vaccination information, the Cleveland Clinic COVID-19 vaccine website, and it's at clevelandclinic.org/COVID vaccine. The phone, or you could call area code 216-448-4117 for vaccine appointments. So we encourage people to, at the Cleveland Clinic, to have a MyChart account with the Cleveland Clinic, because that's a way not only accessing their medical information, but also having access to getting vaccine registration and appointments. But if you do not have a MyChart registration, then calling for the vaccine appointments is also very, very appropriate. We try to make it easy for you. Of course, there is the Ohio's Mass Vaccination Clinic. You can sign up for free COVID-19 vaccines. And easy to remember, gettheshot.coronavirus.ohio.gov. And if you need a ride, if transportation is a barrier to going to one of the mass vaccination clinics, then you can call United Way at 211 for registration, and they will help you access transportation as well as helping you register for the vaccinations. So again, very, very important that we have this information so that when you decide to get the vaccine, and we really do hope that people decide to get vaccinated, that there are no barriers to you proceeding and to you doing this. If there are any specific questions related to women and vaccines, there's going to be an upcoming virtual event that is titled Answering Women's Questions about the COVID-19 vaccine that will be held on Tuesday, May 11th, 2021 from 12 to 1 p.m. Eastern Standard Time. And just as additional reminders, as far as some of our other sites where we provide care, we have the Langston Hughes Outpatient Care, and it's a new home for our primary care. And we just want people to know that in addition to primary care, mammography, health education, working with social workers, behavioral health social workers, and patient navigation, which is a very important aspect of patient care, where you actually have someone help you navigate the medical care that you received in order to improve outcomes. So there is opportunities for appointments at 216-445-0700, or if you need more information related to Langston Hughes Outpatient Care, 216-361-1773. So again, thank you from the Cleveland Clinic, and I really appreciate the participants as well as the registrants, and thank you very much. Have a good day.
Thank you.